So I'm here today to talk about positive psychology. I'm the clinical director of the New York City START team, and this is the framework that we use in all of our work. And the START team really works with people who are in psychiatric crisis. And I'm sure some of you are sitting here thinking like, well, that doesn't really apply to me. And that's true. Not everyone's in psychiatric crisis, thank goodness. But just like I'm feeling run down right now by my cold, I think certain times of year or certain circumstances can lead us to feel not well, even if we're not mentally ill, right? Sometimes we, have a lot going on. Maybe we're stressed out. Maybe for our children, there's a lot going on at school or there's a big change coming up, and they might not have a mental illness, but they might have a little mental health cold. Um, I think PERMA is a really great thing to focus on, and we're going to learn about what that is today because, I see it as the first line of defense before needing something like therapy or mental health treatment like medication. Because PERMA is really about helping people have a life worth living and helping people feel fulfilled. So when you think about the history of our understanding of mental health and mental health treatment in this country. It always goes back to Sigmund Freud, the grandfather of psychiatry, really. Um, and it turns out maybe he was a guy who had some serious quirks himself, and maybe that's why he was so interested in the human psyche. So we don't follow everything he says exactly. Um, we don't think anymore that everyone wants to marry their mother or their father, right? But I think a lot of mental health still follows his basic model, and he was a psychiatrist. So he really created psychology in the medical model, which means you tell me your symptoms and I tell you your diagnosis. But we all know that human beings are much more complicated than that. Um, we might have XYZ symptom, but my house was if my house was foreclosed on and my husband is unsupportive or even abusive, um, you could start me on an antidepressant, but that's not going to be everything that it takes to make me feel better, right? So a medical model just isn't enough. Um, so eventually, this field has evolved in many ways, and there's been, many other thinkers to kind of develop the field of psychology, but something more recent was the well-being theory, first conceptualized by Martin Seligman, excuse me, in 2011. So really not that long ago. And he really pushed psychology away from a straight medical model and started think about what is well-being? How am I going to be happy? And what are the components of that? So he found that well-being has a combination of cognitive happiness or satisfaction, hedonic happiness or feeling. Do I feel happy? Am I satisfied with my life? And eudaimonia, which is there meaning in my life? So he kind of coined this term PERMA, and it's really the formula for how to have a life worth living. So PERMA stands for positive emotion, engagement, relationships, meaning, and accomplishment. And so the idea is if you feel fulfilled in these areas, that is when you're going to have a life worth living. And so really the goal of PERMA is to help us identify the why, right? So when we talk about listing symptoms and then getting a diagnosis, I always like to think back to headaches. There's so many different reasons that we might have a headache. A headache can mean so many different things, right? It could mean that we're not drinking enough water. It could mean that there's something going on with us neurologically. There's many kinds of headaches, right? There's migraines, there's ice pick headaches, there's tension headaches, sinus headaches. So we can all take a Tylenol when we have a headache, right? And depending on the kind of headache, that headache is going to go away. But it's not necessarily going to prevent future headaches, right? So when we talk about PERMA, it's really important for us to know not just what somebody's symptoms are, whether it's hearing voices or just, I feel a little stressed out lately, I'm feeling down. But really to help somebody feel better, we need to know why. And so the first one, which feels a little obvious, is positive emotions. It feels obvious, but honestly, I don't think that I started in this field that long ago, maybe 15 years ago. And I was working with somebody who had a severe intellectual disability, and she was clearly depressed. Her father had passed away, and it had been several years, but she was having a very hard time processing that. And so I asked uh, I was an intern at the time. I asked my advisor, what is the mental health treatment for somebody with a severe intellectual disability who's feeling depressed? And a lot of the literature at the time was like very focused on, giving people individualized programming, which is very important, but also so basic. And a lot of the not that much older literature was about how people with intellectual disabilities have emotions like everyone else. So this is all so obvious to us, but I think that the research is very far and tragically very far behind. Um, so it's important that we highlight that to feel good, everyone needs to have positive emotions. And that's what depression is really, right? It's the lack of the ability to feel positive emotions. So Barbara Fredrickson developed the positivity ratio, and I think that we all feel this in our own lives. Um, Negative thoughts are 3 times stronger than positive thoughts. And I didn't do any research on this, like Barbara Fredrickson, but I feel like negative thoughts can be way stronger than that, right? How many of us have had a great day and then somebody says one comment to us, and that's what we pinpoint on and we fixate on, and we hear it in our head over and over, right? Even though everything else was going well. Um, so the tipping point in terms of the negativity positivity ratio is we need to have 3 times more positive thoughts than negative ones in order to feel good. Um, and there's big variability here, right? Again, like some of us might be feeling a little down, a little overwhelmed, a little stressed out. And then as you go down that downward spiral, those things can grow. Those negative feelings can grow, from feelings of worry and doubt to feeling grief and depression and insecurity or unworthiness. And that's something that we really want to prevent. Again, we don't want our kids to feel that way. We don't want them to feel like they can't do things or that people won't accept them. And we also don't want to feel that way ourselves as parents, right? We don't want to feel guilty. We don't want to feel unworthy or depressed, because then it's hard for us to support our children, and get all the things done that we have to do. And feeling joyful and happy is also kind of on a scale, right? Um, Sometimes when people are coming out of a depression, the first thing that they feel might just be content. And then hope. Hope is a really big and important thing for people who are experiencing depression. How can we help that person feel hopeful? But as we move up and we flood somebody with positivity, we can get them towards feeling passion again, feeling enthusiasm for life, and then finally feeling joy and empowerment. And that's really, the goal of psychology, right? We want to reach self-actualization and help people feel empowered. Um, so positive psychology is about a shift in perception. Um, and so some of this is also kind of found in cognitive behavioral therapy as well. We have a choice about what we feel, and that's true and not true to a degree, right? Like if something really sad happens to me, I'm going to feel sad about it, even if I don't want to, right? And sometimes mental health crises come because I'm ignoring my sad feelings. But I think in the long term, we can't change how we feel necessarily, but we can change our perspective on how we feel. And so that's really where our choice is. I don't think I wrote this slide. So we have a choice to shape our perspective about how we feel. And we can do that and model that for our children. that it's normal to feel sad about things, but we still want to try to find the hope in them, right? And when we try to refocus, acknowledge the pain and the sadness, right? Positive psychology is not about telling people, look on the bright side. And I want to really hammer that down. I think sometimes people hear the phrase positive psychology and they think that it means like, no matter what happens to you, I'm going to tell you to think positively about it. That's not the case. There's some things that there's nothing positive in it, right? Um, a loss, that's not positive. Abuse, I'm not going to tell you to think positively about being abused. But the way that people overcome challenges and become resilient is by shaping their outlook on their life and helping them find hope to move forward. And so that's really what positive psychology is about, and honestly, most psychology. um, it's how can we change our perceptions so that we can move forward and overcome things. If you change the way you look at things, the way things look change. Engagement. So this one is really, really, really important for people with IDD in the world today, especially as they transition out of school. You know, most students who go to school, um, you know, they have access to engagement, right? Sometimes people end up in my program because there's a challenge in getting somebody into a day hab or an appropriate day hab or vocational program. And now this person is getting really understandably very frustrated and depressed and discouraged because they lack engagement. Um, but, you know, it's not just about being in a program, right? It needs to be appropriate engagement. Is this something that the person enjoys? Is this something that helps the person feel in flow? Is this where they want to be? And is this helping them reach their goals, right? Like, if I have somebody who loves art and we put them in a basketball camp, like technically, yes, that's engagement, but it's not appropriate engagement. And I think that that's somewhere that the system fails sometimes. And that's where it's really important that you, as parents, become very strong advocates to help your children get the programs, not only just to be in something and for the sake of being in something, but that's appropriate. So, how does engagement help somebody have a positive experience? The event is freely chosen, right? Um, and that can be kind of hard sometimes when, especially it's a student, they don't want to go to school and we're making them go to school. But they're going to have positive emotions at school and the parts of school that they enjoy, right? And I think a lot of kids too, like, have a really hard time getting out the door and don't want to go. And then once they're there, they do enjoy themselves or they find things at school that they enjoy. So it's important to remember that too, especially if you have a hard time getting them out the door every single morning and you want to pull your hair out. Sometimes it's just that transition and getting there. Just like getting a young child into the bath. Like, you can't get them in, you can't get them out. Um, so positive experiences, the goal is clear, right? There's a higher degree of self-focus. A loss of self-consciousness occurs and time is distorted. And think back to the activities that you enjoy, right? When you're really enjoying yourself and you're in flow, you don't have a big sense of time. And that's kind of connected to you know, the mindfulness theory and dialectical behavioral therapy. When we're focused on the present and what we're doing and we're enjoying what we're doing, we're not thinking about all the things that are worrying us. We're not thinking about politics or the bills that we have to pay or our deadlines. If our kids are in flow, they're not thinking about the person that they don't get along with at school or their homework or, you know, maybe grandma's sick. When you are having a truly positive experience, you're in the moment. And that's very therapeutic, even without it being a therapy. Um, there's a sense of control in the situation or activity. Bodily needs are less noticed, and there's an effortlessness in the activity. So again, sometimes we need to strongly encourage somebody to participate in a positive experience, but it can't ultimately be coerced, right? Like there has to be some buy-in from the person eventually. Um, and again, I've been talking about flow a lot. So I think flow within positive psychology is what mindfulness is in dialectical behavioral therapy. When you're in flow, you are truly in the moment. Um, and you know, it's outside of everything else, it's just having those experiences are just a really important component to human beings and to humanity and to feeling good. Um, but when we have those positive feelings and positive moments, it also makes us more resilient to the times when we're not in flow. Because it's a break. It's a break from feeling all those feelings of anxiety and boredom. Relationships. This is also a huge one for people with autism and neurodevelopmental differences, right? For people with intellectual disabilities, forming friendships can be harder. Um, but for the most part, people want those friendships. I think that for a long time, there was this thought that someone with autism, because they don't always seek friendships in the way that it makes sense. Like I would look at someone and say that they're seeking a friendship, that they don't want it. But it turns out that that's really not true. People with autism tend to report higher levels of loneliness than other people. Because human beings are social creatures, right? We all want relationships. And we all want many different kinds of relationships. We want good relationships with our parents, right? That never goes away. Even in adolescence, when it feels like our children don't want a good relationship with us, they come back, right? Most people want a good and positive relationship with their family, but they also want more than that, right? We all crave friendships, and we all crave romantic relationships, and that can be really hard to achieve for people with intellectual differences, right? Um, and maybe they need a lot of extra coaching. And for some people, maybe having a strictly sexual relationship won't be appropriate, but um, they still want that romantic relationship. That the the person that I was referencing earlier, who had a severe intellectual disability and very, very limited verbal skills. Um, Unbeknownst to her, she was actually in a love triangle. So one man at the residence liked her, and then another woman at the residence liked that man, and so the two women were always fighting. But they had they severe to profound intellectual disabilities, but they still had those feelings. um and this was a long time ago, and they were on the older side. So I think when they were younger, people didn't coach them on how to be a good partner, how to look for a partner. But we're seeing more and more how important that is, and it has to be age appropriate, and it has to be appropriate to somebody's skill set. But being supportive and educational in terms of how somebody finding friendships and finding romantic relationships is really important. um and this isn't really going to be relevant for the people on the call, because you're all here as parents. um but a lot of the people that I work with don't necessarily have a lot of family involved. Maybe they're older, maybe they were in foster care. And so in the spectrum of people with IDD, some people really don't have any relationships, and that's really tragic. They only have paid supports. And so how lucky your children are to have you, right? And I think finding relationships that will outlast you, that your children can have, is really important as well. I mean, it's not an easy thing to think about, but so how can we foster positive relationships? And this is true for us, but we also need to, I think, educate the world around us as to how can we be a good friend to somebody who has an intellectual disability, right? Because we all are members of the society, and we all have a responsibility to do that. Um, Be consistent. I think that that's really important for everyone in a friendship, right? But it's especially important to be very consistent when you're friends with someone with autism. Um, I think that there's a level of forgiving that a lot of us have for if someone's flaky because maybe they have young kids or a lot going on that someone with autism might not have. They're going to pinpoint like, hey, you were late 3 times and I'm upset about that. So how can we help people be more consistent? Create a culture of safety. Creating a culture of safety means being emotionally open and being open with your own emotions and again being consistent and doing what you say that you're going to do so you're not increasing anxiety for people. That's a huge thing that I see a lot in my work is that people will talk about what they want to do, even if it's not necessarily realistic. And then the person who has the autism, um, they see it as a series of broken promises, even when it's well-meaning. And so that creates a lot of anxiety. So how can you reframe discussions so that you're not making promises that you can't keep? And sometimes you feel pigeonholed, right? Like, you know, everyone's different, but some people can be really insistent, like, I want to do this. I need to know what day. When are we going? I want to go to the dollar store. I want to go to the dollar store. Um, but it's really important for us, to help other people have their PERMA that we don't just give a throwaway answer and that we really be thoughtful. And that's not easy. But if we get in the pattern of that, then it creates less anxiety down the line. And then active and constructive responding, which is something I think we're going to talk about more in part 2 of the positive psychology talk. But really, what active and constructive responding means is just being really, really enthusiastic, right? Like, you drew a picture today that is the best picture I've ever seen. I'm going to put it up, and you should be an artist, right? It all falls back to that positivity ratio. How can I help somebody feel good when they don't feel good? And the way to do that is really to drown out those negative thoughts and feelings. And here's just an example of active constructive responding, right? Somebody has good news about a promotion. We could say that's nice. We could completely ignore them, which is not going to make them feel good. Or we can say, woo! Right? And so to be a good friend and to be a good parent to someone and just to be a good uplifting member of society, we want to always try to use active constructive responding. Um, Meaning, it makes sense, right? Like we all want to feel like we're part of something. We all have a why that's our own, why do I get out of bed every day? And I think sometimes, and I'm sure as parents you see this yourself, I think sometimes being able to follow your own purpose and your own meaning is not an opportunity that's always afforded to people with intellectual disabilities. And things are getting better, but we have to always be that strong voice and push for more, right? Because it's important that just because somebody might not be speaking, that doesn't mean that they don't have a purpose, right? And so, how can we help all individuals connect to things that are larger than ourselves? And that can be in many different areas. For some people, it's religion. For some people, it's career goals. For some people, it's, lifetime students. Um, but, again, the goal of mental health and of psychology is to help people reach self-actualization, which is to become the best version of you. And we can't do that if we feel like everything's empty. Think about the 90s. The 90s was a time where, people could graduate from high school and buy a house and support a family of 4 on an income of 1. But there's still all these movies in the 90s of people feeling depressed and burnt out from the corporate life. So I think even when people have all their needs met, without feeling a sense of purpose, we're still not going to feel good. Yeah, so meaning can be very different to different people. Wanting to create a family, and this is a huge one. I think that I see a lot in the work that I do is the grief and loss that people feel when it turns out that they maybe aren't going to have that traditional life of getting married and having kids. And that can manifest in a lot of different ways. Um, but I have also worked with a lot of people who were able to kind of transfer that need of creating their own family to like working with kids or working with animals or having a garden and just nurturing in another way. And so, we can't always have our first foremost dreams fulfilled, but how can we reshape it into a way that's realistic for that person? Meaning might mean wanting financial or other independence. And again, for some people, that being completely financially and otherwise independent might not be realistic, and that might be their goal, right? Um, but we can always work towards as much financial and other independence as possible. And there's ways to do that, and there's services to help with that, like ComHab, Day Hab Without Walls, vocational services. So, again, I think a lot of us had dreams when we were growing up that maybe we didn't reach. I thought I was going to be president, and here I am. But we can always reshape as we grow, and reality kind of sinks in, and refocus and find a way to feel meaning and self-actualized, that is achievable. And other ways people might feel meaning is through religion, which is wonderful, and through volunteering. And achievement, right? We all want to feel like not just that we have a sense of purpose, but that we're doing a good job. Um, you know, eh, if we go to school and we're getting all C's and D's, we're going to feel discouraged. And I think that's when it's really important to make sure that, our kids have access to the right vocational program. And if not, can they get an educational advocate? Because nobody wants to work really hard on a paper and turn it in and see all red marks on it, right? We all want to be in an appropriate setting where we're trying to achieve, where we have our goals that are achievable, and somebody helping us to work towards those goals. And so a lot of the people that I know I've worked with across, different settings is some people have a hard time setting realistic goals, right? And that's kind of what we were just touching on. If your goal is to become the next Jay-Z or to even be Jay-Z, like I don't know if I can help you with that, but I can try to help you get pointed in the direction of music therapy or, a recording studio. You can write songs. I just can't guarantee you that you're going to be on, performing for the Super Bowl halftime show. Um, And then on the other side of it, some people have internal and external low expectations, right? And I see this too. I can't do it because I'm disabled. Um, and yes, if somebody has a disability, that means that they might need extra help in certain areas, but everyone can work towards a goal of some kind, right? And so we want to make sure that our kids don't feel like having this label or diagnosis means that they can't achieve, because it's not true. I've seen some pretty incredible things from people with disabilities. Really, really incredible. Um, I worked with someone who I think she was 15 when I first met her. And she was someone who at first was obsessing, she had autism. I want to have a baby. I want to have a baby. Well, she was 15, so it really, regardless of what she's able to do as an adult, she wasn't going to be able to have a baby right at 15. We really didn't want her to try for that. So, somebody had kind of steered her towards, why don't you have a goal of working with children? And when I first came to this agency, the school really wanted to sit her down and tell her that that wasn't a realistic goal, because she asked the same question over and over and over again. And she would just go up to people and tell them that she had schizophrenia, which, looking back, I don't think that I know that she didn't even have schizophrenia, but someone had said that to her once. Um, but I refused. I said I wasn't going to tell her that she couldn't work with children. And instead we worked on those things. We talked about not telling strangers any medical diagnoses that you might have. And we practiced the whole, like, at first she was allowed to ask me each question 3 times. And then we got it down to twice, and then we got it down to once. And after once, she would have to answer it herself. And by the time she was 19 years old, she was working with kids in a preschool or in a daycare. Um, so there were external low expectations of her. People didn't believe in her. But instead of just telling her, no, you can't do this, I sat down and my team sat down and we told her, these are the things you have to work on, and then you should be able to achieve your dream. And she did it. And I've never been more proud in my life of somebody. She could be a CEO if she wanted to. And then for some people that I work with, institutionalization is a barrier to experiencing achievement. Um, and we see this to a lesser degree with like the offerings of day hub, right? And it is frustrating. We want our kids to have more options, right? There's limited resources, it's funded by taxpayers and we keep having our taxes cut and people don't want to pay their taxes. So, um it sometimes feels like in certain settings they treat everyone the same. And the only way to get things done is to be really loud, and then you get labeled as being non-compliant or difficult. Um, but I think the things, at least in New York, are getting better. Um, even in my current role, I've been there about 4, maybe 5 years. And I've seen more of an openness and more reception to, again, helping find somebody, not just put them in a program for it to be a program, but to put them in a program that's appropriate and that meets their goals and their personal needs. Um, I can't see on slides. Okay, sorry. So we always want to focus on somebody's strengths when we're trying to help them find resources, right? I think like a lot of well-meaning care managers and providers and people in at Start, sometimes they see a problem and they just want to throw resources at you. And for you as parents, it's just too much sometimes, right? So we really want to look at, what is this person good at and how can we find resources or programs or what have you that fits those strengths. We feel good when we're doing a good job. And so, you know, looking at somebody's strengths is really important for that. And we'll talk about strengths a lot more in part 2. Oh, that might be my last slide. No, I didn't think so. Okay. And plus, so, PERMA was originally PERMA, and then they added the plus, and plus is for general wellness and well-being. Um, so physiological wellness is really important to feeling good, right? I mean, there's a really high rates of depression and anxiety amongst people who have chronic illness. And chronic illness can be really scary stuff, right? But it can also be things that are caused by us just not taking good care of ourselves. And it's hard. Like, I don't always take good care of myself either. I'm really busy and, I have a 2-year-old and I just like going to the gym isn't always a priority, right? But it's also really important because when I'm chasing my daughter around, I don't want to be getting too tired to do it. I don't want to have back problems, right? So it's hard and it's easier said than done. And those of us saying to do it don't necessarily do a good job of it either. But physiological wellness for everyone, for the whole family, is really important. And, I think we talked about this last time. Do as I say, not as I do doesn't work. So I think modeling physiological wellness is really important so that your kids have it because they get their habits from us, right? So physiological wellness can mean all kinds of things. It can mean optimism, right? If I miss my train and now I'm going to be late, how am I going to respond to that situation? And how am I going to model my response? And what am I going to tell myself inside my own head? Am I going to beat myself up and be so angry? And then my whole day is ruined. And then I get home and maybe I ate some ice cream because I had a bad day. And it just becomes this spiral, right? Nutrition, so hard. Food is really expensive right now. But how can I try to add a little more fiber to my diet? You know, they say Americans really don't get enough fiber. How can I add beans once a week? How can I try to eat at least one or two vegetables a day, right? Even really small changes is really important. And again, like your children might be super picky and they might eat five things. And if they only eat literally five things, please see a doctor. But they might be really, really picky, right? And they might not want to eat other things. But if they see you eating other things and they see you eating healthfully, they're going to internalize that. And maybe as they get older, they'll be more open to eating healthy food. Physical activity, again, it's like 10 degrees outside. So it's hard even just to go for a walk, but maybe once it warms up a little bit, even just going for a family walk and trying out those mindfulness walk activities that we talked about last time. And then sleep. Put your cell phone down at 10 p.m. and really try to practice good sleep for yourself so that we can model good sleep habits for our kids. And, you know, we all know that children with autism are prone to having really, really poor sleep. Maybe they have a hard time going to sleep. Maybe they have a hard time staying asleep. I've met people who they sleep 3 hours a night. If there's serious concerns about sleep, please see a doctor. You know, there's really benign medications and strategies that you can try to help with sleep. If someone's only sleeping for 3 hours a night, like that's not healthy. But overall, you know, when we feel good, we have the energy to do activities that promote PERMA. If I feel like crap every day, I'm not going to be working on my positive emotions or engagement or my relationships or my meaning or achievement, right? I'm just going to want to sit in bed all day and eat chips. So it's easy to put it on the back burner, but physiological wellness is so important too. And so um ultimately the goal of positive psychology is to increase resilience. Again, there's certain things where like there's no bright side to them, right? There's no bright side to losing a grandparent or a loved one. There's no bright side to being abused. But we all live in this world, and it's important that we find a way to move past the bad things and the really hard things so that we can go back to feeling joy and happy and satisfied. Um, and so the goal of positive psychology is not to say, think positive. You do not have to think positive about the sad things in your life. By positive, we mean the opposite of negative, right? So we by positive, we want to help somebody use their strengths and the good qualities about them to move forward. We focus too much on what people's deficits are, right? When we're diagnosing somebody with an intellectual disability or with autism, those are deficit-based evaluations. When somebody is getting evaluated for their needs in school, those are deficit-based evaluations. When we want to help somebody feel better, yes, it's important to consider why they're not feeling good and what their symptoms of that are, but we also need to think about what do they do well? What are the good things about this person? Because when we refocus things in that way, a few things happen. One, the identified patient, whether it's ourselves as exhausted parents or whether it's our kids who are being bullied or feeling anxious or stressed out or down at school, they start to see themselves through their strengths because that's what we're talking about, right? But when everybody is using positive psychology as a framework, it also helps all members of the system see this person in a better way. Sometimes I'll have somebody enrolled in my program where the school is just like they have this behavior and that behavior and this behavior. And so one of our assignments to the school is I want you to write down 3 things that they do well every week and call up the parents and tell them every single week. And so what happens when they do that is not only do they start having, parents you guys get tired of hearing all the things your kids are doing wrong at school, right? Now you're hearing all the things that the teachers are saying that they're doing well, and you feel better and like more warm, happy feelings towards the school. But it also is forcing the teachers to look for the good things in that person, right? And so even though we're acknowledging the challenges and not ignoring them, we're also finding those strengths. And we might say, hey, they're always asking me if they can help me. Maybe I'll give them a helper job in school. And now they have an opportunity to have some meaning and some achievement as a helper. Um, and so building resilience doesn't happen overnight. And what resilience might look like and how to build that is very individual. But by looking at what somebody does well, I think that's the best step forward as to how to help them feel better and how to help the system help them better.